It is Oral Head, Neck, and Cancer Awareness Week. Joining us live to talk about more about some risk factors, symptoms, and treatment is Dr. Duncan Savage, a radiation oncologist with St. Peter's Health Partners Cancer Care. Good afternoon, Dr. Savage.
Good afternoon.
First, let's start with some basics. What is oral head and neck cancer?
Well, cancer can arise in many different places in the body, but one of the places where it certainly can arise is in the mouth, the oral cavity, sort of back where the tonsils are, and further down into the larynx area. So all these sites are really talked about as head, neck, and oral cancer. They're grouped into that category, but there are many different subtypes of different types of head and neck cancers.
And what are some of the most common risk factors for these cancers?
Well, some of the risk factors, there are several major risk factors. Tobacco abuse and alcohol use are associated with head and neck cancer. We also know that there's a virus, the HPV virus, that is increasingly common in patients, and that seems to be responsible for a growing number of cancers back in the tonsillar area and in what we call the base of the tongue. And the base of the tongue is the area of the tongue when you go around the bend of the tongue towards the esophagus. That's the base of the tongue area, and that's where we can also see HPV-related cancers.
What symptoms should serve as red flags?
So I think any unusual swelling in the neck, typically lymph nodes you might have from an infection, would usually disappear or go down in size in 2 or 3 weeks. So if you have a persistent lymph node, especially if that lymph node's not tender, that probably should be something that would want you to go see a physician. Another thing that you'd want to take a look at is any unusual ear pain or difficulty swallowing. So those things are things we'd be taking a look at. Some of these areas you can actually take a look at yourself. So if you open up your mouth and you have a painful sore that's not going away after 2 to 3 weeks in the oral cavity, that'd be something that would want you to get further evaluation.
And what can someone with risk factors for these cancers do prevention-wise?
Well, I think the first thing that I'm always saying is to stop smoking. There's nothing good about smoking. There's no good spin I can put on smoking. So stopping smoking will reduce your risk of having head and neck cancer. I think limit some of your alcohol use. HPV infection is a more difficult question to answer because once you have it, you might not even know that you have it. And so very many people have HPV infection that's kind of dormant. One thing I would point out too is for younger people, the CDC has now changed its recommendations and have recommended vaccination for individuals up to 45 years. So our hope would be is if we get enough people vaccinated and more widespread vaccination, we'll actually be able to see a big decrease in the risk of these HPV-related oral cancers.
And what are some of the available treatments that patients can expect?
Well, typically for cancers in the oral cavity, so that's in the front of the mouth area, typically that's handled with surgery. But as cancers spread further back into the back of the tongue and into the base of the tongue, into the oropharynx, typically that's treated with chemotherapy and radiation therapy, and that's actually a very intensive treatment. Typically, treatments are given on a daily basis, Monday through Friday, for about 5 to 6 weeks. And also, in very many cases, chemotherapy is utilized as well. So this is something that theoretically, with more widespread HPV vaccination in the future, is going to be something that's going to be decreasing. And would like to kind of think is this type of oral cavity cancer is going to be a preventable disease.
Great. Thank you so much, Dr. Duncan
Good.
Savage. Appreciate you
Good.
taking the time to talk with us.
Good. Thank you.